Hello, my good people. Let me welcome you to our today's episode, whereby we are still discussing about diarrhea, which has been having so many subtopics, which are very important in our today's life. And before I continue, as my rule, I always appreciate the fact that your support has taken me the far I've gone. If it weren't due for you, or if it were not for you and your support, this channel could not be where it is today. You have made me part of your family, and that's why I'm pushing hard and giving you guys educational bangers each and every day without getting tired. Let's continue keeping the support on. Let's continue sharing, liking and commenting on our videos so that they may be recommended all over the world. Imodium. This is one of the medications or the treatments used, or one of the drugs used by many people. And if you go to every locality in the society and ask about Imodium or Loperamide, many people know it for diarrhea cases. So we'll be talking about Imodium or Loperamide, its usage, dosage, and its side effects. Anything that has advantages or that has benefits, it must have disadvantages. So, Loperamide or Imodium. Imodium is an over-the-counter drug or an OTC medication. That means you can just buy it from the chemist without having a doctor's prescription. So Imodium is an over-the-counter medication that is used to relieve diarrhea, and you can take it as soon as you experience symptoms. Imodium is an over-the-counter medication that is used to relieve diarrhea, and you can take it as soon as you experience symptoms. The active ingredient of Imodium is Loperamide. Active ingredient means the part of that medication that is useful in your body, or that is used to relieve the symptoms you are having. That is what we call the active ingredient. So the active ingredient of Imodium is Loperamide. How does Loperamide or Imodium work? It works by making, get this very clearly, Imodium works by making the muscles of your intestines contract slowly, resulting in firm stools. Imodium works by making the muscles of your intestines contract slowly, resulting in firm stools. That means it makes the watery diarrhea harden or get firm. Imodium has low side effects, but when side effects occur, they are very mild. That means it's well tolerated by your gut. Imodium has low side effects, but when these side effects occur, they are very mild. How does Imodium work? When you start diarrheaing, you go to the chemist and ask for Imodium. Have you ever sat down and asked yourself, if I take this medication, how is it going to work to control the diarrhea I'm having? So how does it work? Muscles in your gastrointestinal tract contract and release at regular intervals, which helps move the food you have eaten through the digestive system. Get this very clearly. Muscles in your gastrointestinal tract contract and release at regular intervals, which helps to move the food you have eaten through the digestive system. Medically, this is what we call the bowel movement or the peristalsis movement. So, muscles of your gastrointestinal tract contract and release at regular intervals, which helps to move the food you have eaten through the digestive system, or it helps in peristalsis. During this process, intestine absorb water and nutrients. During this process, which process? Whereby muscles of your GIT contract and release at regular intervals, which help move the food you have eaten through the digestive system. During this process, intestine absorb water and nutrients. In the case of diarrhea or with the diarrhea, gut muscles contract too quickly. We have said they contract slowly, but when you have diarrhea, the muscles contract too quickly. Food matter movements that are more frequent than usual. With diarrhea, gut muscles contract too quickly. Food matter moves through the system too fast, resulting in watery bowel movements that are more frequent than usual, and that is what we call diarrhea. Let me explain this again. With diarrhea, gut muscles contract too quickly. Food matter, or what you have eaten, moves through the system too fast, resulting in watery bowel movements that are more frequent than usual. Having diarrhea makes it harder for intestines to absorb fluids and nutrients such as electrolytes, because it's passing too quickly. The movements are too quickly than usual. So that's why we are saying having diarrhea makes it harder for intestines to absorb water and nutrients such as electrolytes. This is because when the movement of the bowel contents or the food you have eaten is slow, it gives your intestines time to absorb water, nutrients and electrolytes back to the body. But in the case of diarrhea, it's too fast. There is no time for the intestine to absorb the water, the nutrients and the electrolytes. I hope you get this. Your body needs electrolytes to function well. Your body needs electrolytes to function well. If diarrhea persists, low levels of fluids and electrolytes can trigger dehydration. If diarrhea persists, low levels of fluids and electrolytes can trigger dehydration. Imodium contains loperamide, a drug that slows down muscle contraction in the gut. Get this very clearly, and this is how Imodium controls diarrhea. Imodium contains loperamide, which is the active ingredient, as we have said, and a drug that slows down muscle contraction in the gut. This in return slows down the movement of food through your digestive tract, so that the bowel can absorb the fluids and nutrients your body needs, including electrolytes. This is how Imodium controls diarrhea. How? Imodium contains loperamide, a drug that slows down muscle contraction in the gut. This in turn slows down the movement of food through your digestive tract, so that bowel can absorb the fluids and nutrients your body needs, including electrolytes. A point to note: after you take Imodium, your bowel movement should be smaller, more solid, and less frequent. After you take Imodium, your bowel movement should be smaller, more solid, and less frequent. Imodium dosage for adult and children. Let's see the dosage you can give to an adult and the dosage you can give to children. So Imodium is available as caplet or capsule, soft gel, and liquid. All are taken through the oral route. So it comes in form of capsules or caplet, soft gel, and a liquid, and all are taken through oral route. You should not use Imodium more than 2 days in a row or following each other. Recommended dose for Imodium is always based on age and weight. The dose is always based on age and weight. This marks the end of our first video today. Let's meet in the next video, whereby we are going to discuss the specific dosages for children and adults. So let's continue supporting this channel and make it a success. Let's meet in the next video.